Hello, my name is Michelle Karenkevich, and I am here today to talk about getting older. I know it's not the most popular topic, however, I think we can all agree that it is our ultimate goal in life. As Americans get older, there are many changes that take place. Independence can be affected by physical, mental, and social issues. Aging in place is a way for older people to remain in their home environment and maintain their independence. By the year 2030, 1 in 5 Americans will be over the age of 65. The good news is that many people are working longer and staying healthy, so they may not need total care at this point in their lives. They may only require partial supports and services to prevent further decline. This will be much more cost effective in the long run, as staying in the home is cheaper than a nursing home. So the issue is providing affordable and safe options for the older adult to remain in their homes for as long as possible. My proposal is to bring the home environment and the service environment together to accommodate the needs of the older population. The impact of aging in place affects both the older adult and the community in which they wish to remain living in. Let's debate the cost of assisted living versus aging in place. The average cost of assisted living is about $3,500 per month. Included in the cost is food, entertainment, and healthcare expenses. Typically, a retired senior lives in their own home that has been paid off or with a relative, so there are no monthly home costs. On the other hand, there may be a mortgage or a monthly rental payment, which is usually around $1,000 a month. Additional costs for food and basic living expenses could average around $200 to $500 per month. Some additional things to think about are health issues requiring healthcare services. These are usually covered by the assisted living facility. Medicare and insurance may cover some or all of home care costs. Other considerations are equipping the home with safety features, such as first floor bedroom, bathroom, and laundry, grab bars, wheelchair, or walker accessibility. Preparation is really the key to successfully aging in place. People truly wish to have autonomy that comes from living in their own space. Keeping their own schedule and routine are important to them. In assisted living, one has to eat when everyone else eats, and they have to eat what everyone else eats, whereas in your own home, you're able to make those decisions for yourself. Given the choice, it is clear that with the proper preparation and planning put into place, people prefer to stay in their own homes. So what are the challenges to aging in place? The biggest challenge for remaining independent and staying in the home environment is accessibility. Healthy Aging Begins is a report from the Bipartisan Policy Center, which proposes recommendations for the older adult to age in place successfully. Adapting homes and communities to fit the needs of the older adult is the first area of focus. Modifications to the home, such as ramps, wider doorways to accommodate wheelchairs or walkers, and durable medical equipment, can create accessibility. Safety modifications include grab bars on the walls, in bathrooms, removal of throw rugs, and space for equipment. The community can also be equipped with safety features. Having road signs and lighting fixtures and things like that out in the community can really help for the older adult to be able to navigate through their neighborhood. There are also other safety and security features that can be put into place that will help the older adult. Things such as transportation services and ride shares and different things that will keep them safe when they're out and about walking. The community must integrate a range of services to provide for comprehensive aging in place. Wellness programs will help people maintain health through education on exercise, recreational activities that support health and wellness for a meaningful life. A continuum of healthcare provides meal programs, transportation services. This includes mobile care clinics and new technology services with medical facilities who specialize in the treatment of injury and disease of the older adult. Local aging networks to support older adults in finding services for healthy meals, healthcare, and transportation within the community should all be available services for the older adult. Expanding Medicaid services to include home health care. Medicaid mainly funds people living in long-term care facilities and should dedicate resources to community-based services. Affordable and suitable housing is essential for people to age in place. In order to stay independent for as long as possible, the house must be adaptable to easily accommodate disabilities related to the aging process. Safety and security are necessary to avoid injury in the home. As mentioned before, this can be made with modifications to the home, with wheelchair access, first floor access to bedrooms and bathrooms, and technology to monitor health needs. Along with personal safety, affordability is important. This policy should include programs to keep it affordable to stay in one's home. Tax assistance programs can assist households that are low income and struggle to pay property taxes. This can protect the homeowner and avoid a lien on the property. Elderly homestead exemptions can aid senior homeowners from paying school taxes, and property tax credits may reduce property tax liability. Reverse mortgage allows an individual over the age of 62 to use equity from their home as a line of credit. The loan must be repaid with the sale of the home. Communities can provide education on these programs to avoid scams. The impact of aging in place on the community can be very positive. Bringing revenue to the community through jobs and senior care is a main focus. Care managers and specialists in geriatric care are needed. Specialists in relocation and home health care agencies, technology services aimed at education and information for safety and security in the home. Transportation services are huge. As the older adult ages, it can be more difficult for them to maintain a driver's license, a car, for them to have insurance and everything that goes along with that. It's a big expense. Sometimes chronic diseases and disabilities may cause the loss of the license, which is a loss of freedom. And when the freedom is lost, there are many difficulties that the older adult faces. They can be stuck in their home, which leads to isolation and depression. It also does not give them access to quality health care and food sources. So transportation is huge. Transportation services can provide safe transport to and from shops, healthcare appointments, entertainment and social activities, as well as family functions and other safety and security measures. Creating senior centers for maintaining health and wellness is another vital resource. Having a health and wellness center for the older adult can help greatly with combating disabilities, chronic diseases such as heart disease, diabetes, hypertension. There are many studies that have found that the older adult requires moderate intensity activity of at least 150 minutes per week. They should also be doing strength training. This can help with flexibility and balance and stability, which are all issues that happen as the adult gets older, which can lead to falls, which can lead to fractures, and can cause further disabilities. These can all impact the ability to stay in the home and age in place independently. The older adult over the age of 50 account for more than half of all U.S. spending. This is a powerful force to be brought to a community. According to the U.S. Census Bureau data, 71% of Americans over the age of 65 voted in the 2016 presidential election. People over the age of 65 show up to vote well over every other age group. The senior vote must be considered by both parties. The senior voter is very connected to their community. which makes them more likely to be invested in the community voting process. The older voter should appeal to the legislators who will advocate for this policy, because they are not only looking out for themselves, but also their children and grandchildren. This means they are not only interested in Medicare and other age-related issues, but also in student debt, workplace issues, and healthcare across the spectrum. The cost